So I will start that recording now. And Dr. Quinchero, the floor is yours.
Thank you, Patrick. And welcome, Dr. Mendenhall. It's nice to meet you, albeit via Zoom. Thank you for being here. It's quite a nice treat to have you here today. Dr. Emily Mendenhall is a professor in the Science, Technology, and International Affairs program in the Edmund A. Walsh School of Foreign Service at Georgetown University. Dr. Mendenhall has a PhD in anthropology from Northwestern University and an MPH from Emory University. Some of her major works include a book, Rethinking Diabetes, Entanglements with Trauma, Poverty, and HIV, which came out in 2019. And then more recently, I understand she has a book coming out this spring entitled Unmasked, COVID, Community, and the Case of Okoboji. All right. So please welcome Dr. Mendenhall and give her your attention. Thank you.
Thanks. And just to check, do you want me to speak till 4:30 or 4:40, or how long do you want for questions? Because I think we're here till 4:50. Oh, you're on mute now. You're on mute.
Sorry about that. Yeah, I think 4:40 is about right. Gives us about 10 minutes for questions and answers.
Okay. Yeah, sure. Great. Well, it's a real privilege to spend a little time with you all and talk about my new book. I'm a medical anthropologist, and for the last year, last 20 years, I've been asking, or almost that many years, I've been asking questions about trauma and diabetes. I worked at Cook County Hospital in Chicago for 5 years while I was doing my PhD. I was a postdoc for a year in India. I was a postdoc for a year in South Africa, and I've worked in Johannesburg with the same unit for 10 years now. And then I've done some work in Kenya, and I collaborated on projects in Somali region of Ethiopia. And I've been really looking at these questions of how do you experience diabetes when you're faced with trauma and food insecurity and financial insecurity, and what does that look like? And observing that and thinking about that, especially in really resource poor settings in urban contexts, has been the focus of my work on looking at intersections with mental health, especially. So shifting to thinking about COVID in rural Iowa was somewhat of an unexpected turn for me, but I'm going to talk a lot about where that came from and why it matters so much to me. And before I get started, I have to say I spent quite a bit of time in Montana because my husband's family is from Butte, and his mother's from Butte and his father's from Great Falls. So we spent quite a bit of time in the summers traipsing through the mountains, which is just such a wonderful thing. If anyone has a question throughout this talk, please just raise your hand. I don't mind responding to them, because I also am really curious about your takes on this, because I assume some of it will be very familiar to what you are constantly seeing. And when a woman, Seema Yasmin, who reviewed my book, posted on Twitter, she said, "How likely are you to read a book about the pandemic while we're in the pandemic?" And when I wrote the epilogue, which was last March or April, I was like, it's just very strange to be writing an epilogue in the middle of the pandemic that's ongoing. But this book is really about the first summer and the first year of the pandemic. And it's about my hometown. So I grew up in rural Iowa. And when COVID started in Northwest Iowa, maybe some of you know, it's about Okoboji is about Lake Okoboji is a region of about 15,000, 17,000 people in the summer, but 100,000 to 500,000, or in the summer, 17,000 year round. And my brother-in-law, who grew up in Connecticut, moved back with my sister about 6 or 7 years ago to work there. And he had a public health degree. We're very close friends. And he started running the public health program, the public health department, as a family doc. little did he know that his public health training would come into such critical ground, but also how complex that training would really be. As many of the other academics, including probably many of you, the first few months were spent at home with these two little ones. I have two small children. At the time, they actually look so different now, but at the time, this was us making a volcano and doing a lot of science in our backyard. We painted everything in sight. We did science projects. I finished teaching online, as many of us did. And, you know, we thought it was going to be a few months. Well, after, you know, when June came along, I could not be Professor McGonagall in my youngest imaginative story of Harry Potter in our family any longer. And so we decided to pack up and move out west for the summer to spend time. Well, I live in Washington, D.C., so to move out west for the summer to spend time with my family. My sister has two kids the same ages, and as my youngest was 4, and really going through a important social transformation, we decided to go spend some time with family, as many people did. So I'm from Northwest Iowa. If you look at this map, you can see the north corner. I talk a little bit at the beginning of the book about in March and April, you probably read about, maybe there were some in Montana, I'm not sure, but the outbreaks in meat and pork processing plants in Sioux Falls, South Dakota, which is about 100 miles west, and then Worthington, Minnesota, which was on the heels of the Sioux Falls outbreaks. And there's a lot of movement between Okoboji, Spirit Lake, Jackson, Minnesota, Worthington, and then Sioux Falls. So at that moment, we were pretty concerned, and especially Zach and I were constantly talking because we were thinking about how to care for my parents. And also just, I was curious how things were going there and how people were feeling, because where we were, there was a big outbreak and there were lots of cases everywhere. And our experience in the early months were very different than Iowa. And so they were asking us how we were doing and what it was like. And, you know, the conversations just shifted and continued the entire pandemic. But what was really interesting, and you can see this, so on the left, of course, as I researched this book and as I kind of read more about, you know, what like the culture of the Midwest, the culture of my childhood, but also the West. I think Montana and Iowa share a lot of cultural aspects, although they're also are pretty distinct things that we can also talk about, or please bring up. But I think a lot of the kind of in-group collective whiteness that fueled a lot of the COVID denialism is very similar and rooted in these ideas of manifest destiny and really complex, culturally rooted ideologies of independence, which are very much rooted in current day politics as well as the last 200 years. And if you look at so I bring that up in part now to talk about the Iowa flag, because as I was writing, I was like, oh, let me just see if I want to put a flag in here, just, you know, representative. And I looked at the flag and I was like, this is just the epitome of how people conceive of the self in this context. Our liberties we prize and our rights we will maintain. And as we were writing, or as I started writing and I was reflecting on the culture and politics that were fueling COVID denialism, this really struck home. And if you look on the right little image, that is the Lakes region. So Okoboji is one of 8 contingent towns around these 7 lakes. And they are connected there. It's a beautiful area where, you know, people from Omaha and Sioux Falls, some in Minnesota, throughout Minnesota, especially southern southwestern Minnesota, Rochester, Des Moines, people come, some from Chicago to summer or to spend some time. And here is a picture of the flag again and Okoboji. So tourism has been essential to Okoboji's economy since its founding. I write a little bit about the myth of its founding because there's, as so many narratives of the interaction between white settlers and Lakota and Dakota in the Dakotas, also in Iowa and Minnesota, were written as very kind of overly exoticized and essentialized narratives. There was one actually that's often called the Spirit Lake Massacre. I tried to refer to it as a conflict though, because the story is told by a young woman at age of 13, young white woman who lived then, who survived the conflict and then lived with the Dakota, with Inkpaduta, who's actually been written about quite extensively. And so the kind of narrative and this myth of the community is really built on her story. And it's memorialized with a cabin and a museum, as many are in many kind of narratives or myths of their founding are. And around that is this sort of idea of deservingness, of deserving this land, of deserving this community, of deserving the resources. And so really kind of complicating what that means was important to me. And I use this photo because this is a photo of people actually used to come from Chicago and New York and Boston, as far as there to come fish in the Okoboji region, Iowa Great Lakes. As early as the late 1800s, their railroads came in around 1880. And so people came in to fish. And if you look at these fish have actually been fished out of the lake, paddlefish. No longer can you fish them because tourists came in and extracted these resources out of the lake. Thinking about preservation of the lakes and the water quality and the complex dynamics between development and extraction and the lakes is part of my entire childhood and family. My mom's been a citizen scientist my entire life. She's been monitoring the water quality I did as a kid. So this has really been the center of how I think about and grew up in this region. So tourism, I talk about it as cultural practice. So this is super funny. There's these, actually I grew up with the kids of the people who started this, but they started this fictitious University of Okoboji. And you can see it says, "In God we trust, everyone else cash." It has a picture of Okoboji. And they joke that we have everything but the classes. And, if you read online, and I should actually print it out, it's in the book, they talk a little bit about, basically talking down on any sort of bookishness or academic approach, and like let's let loose and party. And that's really how the community is. And I hadn't really thought about how central party culture is to the whole idea and kind of rejection and cultural shift away from the pandemic and towards the economy that happened during the summer. But tourism as cultural practice was at the center of this area specifically, and I think a lot of other areas. So you can also see over the since the 90s, really the economic boom in the 90s, the community has completely transformed. This used to be a farm when I was a kid. And, I'm 40, so this was in the 80s and 90s. It was all farmland. It wasn't until the early 2000s that it was completely transformed and settled into this development. So in quite a rapid amount of time, we've seen this incredible development of the area, but also extraction. So it's been really focused on how many boats can you get on the lake. And, it's really just about the lack of regulation of traffic and how much money can be made off of this lake. And that's why I juxtapose it to the paddlefish, because the paddlefish, there was no regulation around the paddlefish and they disappeared. And we're seeing an intensification of extraction, which we're seeing, and I see this as really a reflection of kind of the global economy in this smaller ecosystem. And this is a really good example of, on the right side, you see almost 100-year-old cabin, which would have been really big at that moment, compared to these huge monstrosities that are being built on the lake that are really like 3 homes in one. I think actually this home was built on 2 lots. And a lot of these are now, although for years it was families, largely white families, who had generations of homes and maybe lived there full time, or children of children had these homes. Now most of them have been sold, and they're really wealthy people who fly in and fly out. And so that kind of investment in the community has also radically shifted. So I want to talk about what it was like when I arrived. Because when I arrived to Okoboji, I had been quarantining with my family in DC, and we were driving out on I-80 and then I-90, and we got to Fairmont, Minnesota, which my youngest, my daughter had to go to the bathroom, and she also the other one needed to do cartwheels. I got up at 4 a.m. I was so ready to get out of quarantine, and we drove 20 hours in one day. So we get out, one kid's in the bathroom, the other kid's doing cartwheels in a cornfield. And my husband goes in with my daughter, and he comes out and he's like, no one was wearing masks. And they asked where we were going. We'd been masked a week before. We'd been hiking in the mountains of Maryland, in the hills, excuse me, to Montanans, I can't say that, into the valleys in Maryland. And we'd come to a local grocery store, and there were police outside ensuring people were masking. So this is the environment we were coming from. And we were in the grocery store, no one was masked. And they said, oh, where are you going? And he's like, oh, I'm going to Okoboji. He was wearing a mask. And he goes, oh, you going to party, bro? And my husband comes out and he's like, no. And he's like, I think we found the Wild West, just joking at that moment. We didn't know what was going to happen or what it was going to be like, really. And so when we got there, we arrived where, it was just so visceral in some sense, because, I'm in a sphere where we talk about global health, and one of my close friends works on global health security, who I talk about in the book, Rebecca Katz. And so, I was constantly talking to her about kind of policy and like the ins and outs, and she was advising the Biden campaign and then transition team at the time. So it was, really glued into the politics and the processes that were happening around that. So coming out and seeing a complete rejection of the pandemic in some sense at that moment was pretty jarring. But then when we got there and I went to get groceries and no one was masking, I was like, wow, this is really different, even though I'd had that conversation with my family, of course. And so when we got there, there was a huge outbreak. This was it was like June 6th. And cases went from 8 to 50 in a week. And that seemed like a lot for a community of 17,000, although the summer was, I think they were at 50 or 60,000 by then. People were coming. And some people had come early, actually, that year from cities to stay in a less urban area. And we found, and so I went to the grocery store and no one was masking. And there was this huge outbreak. So I asked my brother-in-law, who I had mentioned was leading the public health effort, and he was doing these Facebook messages and basically public education as much as he could. And I said, well, is there anything you can do? Because I know sometimes, counties have the power to shut things down, or, what authority do you have? And he said, well, of course, everything is up to the county supervisors or the state. And at this point, Kim Reynolds, who's the governor of Iowa, who is, really a Republican governor, really was acting in the image of Trump. And at that time, there was discussion that she was potentially going to be put on the ticket when he was talking about maybe replacing Pence. So there was a lot of motivations there to reject the COVID policies and really take a personal responsibility stance, which is a no stance, really. But at that moment, he's like, we have almost no authority. I don't even know what to do. And over the 4th of July weekend, we usually have a huge influx of people. And this is funny, but I remember, everyone remembers in 1997, I think we were ranked in Playboy magazine, the best place to get laid on the 4th of July. And everyone thinks that's really funny in Okoboji, but it's a good example that it even gets this visibility of it. It is a party place, right? Everyone goes there to party on the 4th of July. So we were really worried about it because no one was masking in restaurants. People weren't really social distancing. There was an order at that moment that people had to be 50% capacity and spaced, and that you couldn't require masks. So, there's a big concern. So I was like, okay, I'm going to do a research study. I'm going to figure out what's going on. And so I threw in an IRB. I'm on the IRB, so they went really quick, and I started doing interviews. And I ended up interviewing about 100 people and talking to hundreds. I grew up there. It's my hometown. I was just texting with friends I grew up with since childhood. Maybe people I haven't talked to in a long time, but others who I do stay in good touch with because my sisters moved back and my folks live there. So let me start with Jay. This is middle ground. Moral ambiguities made many people wonder how seriously to take coronavirus. I spoke to a local metal worker who I'll call Jay, who described himself as libertarian and an avid fan of a political podcaster, Joe Rogan. Jay described how important the Facebook videos of Zach, my brother-in-law, were to him, in part because he was frustrated by the inconsistent messages conveyed by the national and state leadership. Jay was, however, reassured by the local public health leadership. My discussion with Jay revealed the tightrope many people walk between messaging around personal responsibility, wanting limited government in their lives, and wanting the pandemic to end. Jay said, "I'm stuck between a rock and a hard place." He took a deep breath. "I'm trying to find the right words to use here, so it's not just like," he paused again. "But like, if this virus is that horrible and that deadly, why do I have to be tested to know that I have it? You know, if it's that bad." So those thoughts run through my head. Then 10 minutes later, I'm getting out of my vehicle to walk into Walmart and I'm putting my mask on. Then again, I don't know. I asked, "So you feel like if it's that bad, why should we need tests? Because you would just know that you have it?" "Right," Jay replied. "And then again, I know that it can lay dormant in your system and you're carrying it around and you can absolutely have no effect from it. But then again, it could kill my grandma in a few days." "Exactly," I said. You know, you get information like that and you're going back and forth, and Jay paused and looked up for a second. "It's just really hard. And I think a lot of the reason it's hard for me is because of the political differences. Can you really trust anyone in our government to tell us the truth? So I just go by the hospital guidelines." "Yeah," I said. "You know, I can't remember his name from Lakes Regional. He's on there all the time. You know that guy who looks like Lin-Manuel Miranda? Have you seen him?" I burst out laughing. "Yeah, he's my brother-in-law." "Well, it looks like Lin-Manuel Miranda. And I swear to God that one of these times I'll just be watching a video and he's going to break out and singing Hamilton." Still giggling, I said, "Oh my God, can I tell him that? He would love it." "Yes, absolutely." Jay laughed right through his belly. "You know, I love that because one reason I got involved is because I do public health stuff and he's been working on this so much. I've been trying to help out, you know? But I don't think there's an easy solution. It seems like just all the stuff you're saying is dependent on a policy directive from the governor." "Right," said Jay. You know, and then I was listening to our governor speak the other day at her press conference, and while watching her Facebook videos, I would read the comments. There were people begging for a shutdown, and then the next comment would be someone saying, "Don't you dare shut us down. We'll be just fine," you know, whatever. And it's like, he paused again. "They're just so far apart, you know. I voted for you, and I guarantee I'll vote you out because you won't shut down our state." And then the other people are like, "I didn't vote for you, and now I'm going to because you didn't shut down our state." And it feels so divided that it's not like there's any middle ground, I said. But Jay disagreed. There absolutely is middle ground, but there's absolutely no way, in my opinion, for it to be reached because people have just put up such big walls that there's just no way to even hear the other side. So at the end of the summer, I had done I was about at 100 interviews and schools were opening up. And we had just found out that Georgetown was going to go virtual where I teach. And we found that our schools were also, my kids' schools were going to be virtual. And I knew that my 4-year-old would be in this in-person small little preschool she was in. So I wasn't worried about her. But my older daughter has some learning challenges, and I was really worried about her being virtual. So I thought about staying at home and staying with my family in Iowa. And I decided not to for a number of reasons. But one of the big decisions was participating in the school board discussions about masking in the schools. I went to a working group meeting where the entire school board was unmasked, and they're really dismissive, except for one school board member who was promoting masks, at least among middle and high schoolers, and everyone else was dismissive for many reasons. And I go into detail in the book about the discussions and the tension around it. It was really, really interesting. And then they voted actually to have some masking. But in the middle, right after the first meeting, I had been writing this piece, and it was placed with Vox about the complexities in politics around masking. And I placed it the Saturday. So the first meeting was Monday, and I recorded it, and I actually talked about it in the Vox piece because it was so provocative. And then it came out on Saturday morning, and my brother-in-law was supposed to speak with the superintendent, and he canceled on him. But the next Monday, it was actually, I've done work for a long time, and this was the most circulated of any of my work in my entire career. And I was like, I was just floored by it. I wasn't surprised because it was so political, but it was just interesting. I had people from around the world texting me like, "Oh my God, I saw this." which was really interesting. A friend of mine who's a photographer, a family friend, did all the photos, and I really think the photos are what gets it, because you can see this pretty provocative at the time. But it did happen that the next meeting was much more respectful, and there was some masking that was required, which was a relief. We dug through some of the data. So this is also one of my favorite pieces I've ever published. This is a social science and medicine piece that really dug into the complexities of the data. And I have to share with you because it's just such a silly project. The first author is my husband, the middle author is one of my best friends, and then the fourth author is my aunt, who also participated in the project, and the last author is my brother-in-law. And I've never worked with family in my life, and it's just a trip to do this kind of work. But it was this intellectual, reflection and project that we did together, which was wonderful. And at the heart of this project, my husband does a lot of work on framing. He's a professor at Hopkins. And what came up from this work is the ways in which people thought about COVID were in four pretty, at least at that moment in 2020, which, did shift over the pandemic, but I'll be interested to see how aligned or similar this is to Montana. I shared it with some of my family in Montana who are in healthcare, and they agreed it was actually pretty similar. So let's see what you think. But this, the first frame, so we kind of put it as COVID-19 is a conspiracy, constraint, concern, or crisis because it, this, therefore I will. So it shows how people, the frame and how it relates to the perception and the action. So COVID-19 is a concern, which was the most common response, because it uniquely affects me or my family, and therefore I will protect myself. So here's an example of concern. I've been trying to be proactive, but at the same time, I've said to people, what I guess people just have to make their own choice. And my choice is to stay safe, wear my mask, not be in crowds. Another related frame, but much more extreme, was the framework that people in global health, in my field, academics, were really taking is this crisis frame. COVID-19 is a crisis because it has profoundly altered life worldwide, and therefore I will do anything. A good example of this is, honestly, it's changed my perspective even driving down the road now, because I'm viewing humans differently as to how they are caring for other people. And so if they have so much disregard for other people, how are they going to see driving so fast this vehicle, I have all these other mind-boggling perspectives on human nature that comes from this, that I feel we've gone so far from the general moral of what it is to be human and what it is to live in a community to take care of one another. The next one was COVID-19 is a constraint because it threatens financial and personal stability. Therefore, I will resist control. And this was a very common perspective in the business community. I think money can insulate you from a lot of problems. And this is the problem that goes through that. And all of a sudden, the things that affect people in Walmart now are affecting people on the wealthy part of town. And that is not something that usually happens. But the people who work at Walmart are a lot more used to being inconvenienced. And I actually found that the people who didn't care about wearing masks the most were more lower income. So I had a woman I grew up with all through childhood who was a manager at a small, it's called Menards. It's kind of like a small Home Depot, regional Home Depot. Maybe you have it in Montana, I'm not sure. I don't think so, but it's basically, she said, well, since March, I've been making homemade masks for my my employees because they don't have enough money to make masks and care for themselves. And I want to make sure they feel safe. And I thought that was really, really neat. That she was recognizing the risk. And she also said many customers make fun of us for masking. I talk about this in the Vox piece, which I felt was pretty disappointing. And then the last one, which was very common in Okoboji, but unfortunately I had plans to kind of take these frames and go back and do a big survey across the community, because in 2020, 2 in 3 people voted for Trump, and I wanted to know how reflective this frame was and mapped on to the community. I project that most people were within the conspiracy constraint frame. The concern frame was very common among people who worked for the hospital, and the hospital had some sort of 70% of people in town had some sort of employment linked to the hospital system. It's the biggest employer in town. So I assume Those were the most common, and the crisis was the least common. But conspiracy was something that was pretty common. So I'm not a big fan of being dictated. This is very common, this idea of being dictated to, which I'm sure is common in Montana. I'm not a big fan of being dictated to either. You control kids as much as you can. I mean, if you go to school, I'm gonna tell them, hey buddy, 7th grader, but that's different. I know that it doesn't seem to be like a big deal, but that is controlling. The beautiful thing about where we live is that it's everybody's choice. That was actually really interesting, because this was actually a school board member in the working group meeting before the big public meeting. And he said, well, who am I to tell a kid to wear a mask? And my brother-in-law was sitting next to me. He's like, you're a school board member, you're a publicly elected official. You are the person who tells the kid to mask. And it was, it was just so frustrating, because there was just this rejection of authority or responsibility, really. And I'm going to skip that. And we also wrote a piece on, you can kind of go into this more if you want, but we can talk about it later. But we also wrote a piece on basically the politics and meaning of masking, of basically the rejection of institutions, which I think was really interesting. I've talked a little bit about the masking, but walking through town, if you wore, people didn't want to wear it. People actually stayed home in part. They said, I don't actually leave my house because if I wear a mask, I'm judged. If I don't wear a mask, I'm judged. I'd rather just stay home and not be judged. And so the shaming, actually the name of my book for a while was Shame, because shame played such a powerful role in how people constructed COVID in Northwest Iowa. I think throughout the United States, it still is. I mean, I felt shamed if I went running. I have this running path I go on every day, and I was actually publicly shamed by a woman. It was September 2020, and I went for a run, and I didn't have a mask on because I wasn't masking at the time outside when I was outside. And she said, "How dare you come into the space and not mask?" I felt so shamed. I never went on the path again without a mask. But I was told, I was laughed at, made fun of in Okoboji for masking. So, the different ways in which shame acted was really powerful. And I also think it's really interesting, and many of you probably observed this and experienced this. It was the kind of inflammation of institutions. No one talked about the CDC or the WHO really before COVID in public everyday talk. And the presence of that dialogue was so fascinating, and the authority people took. I mean, people joke all the time that like everyone became an epidemiologist and an authority on our field, which was so interesting because people really didn't understand what I did before, which probably many of you experienced. And then we also wrote about, and this has changed, but at that moment when we were writing this piece in the fall of 2020, was the lack of memorialization. And a good friend of mine who does comics for NASA, and he's also from Okoboji area, is doing comics for Unmasked. I just wish I had them for you. They're beautiful. They'll be out in about a month or so, and I can't wait to share them with everyone. But he has this one comic that is really powerful. It actually almost brought me to tears because it's of the cemetery where actually my grandparents are buried, and he drew part of the cemetery, and on the gravestones, he has written, you were fat, you had diabetes, you were old, you weren't, you just these like excuses that, someone I interviewed said, no one in this community is going to care about COVID until someone of status passes away. And then someone of status a week later died. And everyone said, well, he was overweight. And no one talked about it again. And this dismissal of death and life and death was something that became so emotional and difficult to understand. People, and I'm sure this is something but this is this kind of overt individualism and rejection of the collective that is just really hard to swallow in America. But this kind of rejection of people and thinking about people as productive beings and as deserving, right? As deserving of being part of the collective and surviving the pandemic is just really very powerful. So I've talked about masking. Oh, I just got ahead of myself in part because I only have 4 minutes left. So I have another So we talk a little bit about, I talk about the politics of resentment. I assume some of you have read Dying of Whiteness. If you haven't read Jonathan Metzl's book, Dying of Whiteness, it is just so powerful. And the way I frame masking in the book speaks directly, and Jonathan actually wrote a review of the book, which was really kind. But is very much in that same sort of framework of this kind of even the rejection, the politics of resentment are really this kind of, especially kind of white, middle, and lower class in America, rejection of our politics and of our society, and voting against your biological well-being and your rights and your needs. It's kind of like what is the example I always use? But it's like gun control. Like one of the openings to one of his sections is about gun control and how people are, maybe the opening is of this woman who is riding with her boyfriend and playing with a gun in the front seat of her car and not being careful, and then her partner or boyfriend weaving off the road and her shooting herself in the face and dying by accidental suicide. But it's a good example of, kind of not thinking in the way that supports yours. Kind of like tax cuts, when the tax cuts actually take money away from Medicaid or Medicare, for example. And this kind of role of shame. And then I talked about public health institutions. I forgot that I had these slides. I just got away from myself. And I do have a narrative on vaccines, but I think I'll probably end there and open the floor for questions. I have a piece, if you want to read, I have a piece in Scientific American about vaccines because, and I just want to comment on it, even though I can't read Maureen's story. I basically argue in the book, but very kind of acutely in a short little bit in the Scientific American piece that, and this is really building on E.J. Sobo's work and others who write about largely white middle class liberal women in California and Oregon and Colorado. And what I found is that there's a really different sort of vaccine hesitancy in the Midwest, where it's very, it's a conservative, but similarly kind of earthy yoga moms, like they are written about. Like E.J. Sobo's work is on families in the Waldorf school. And this is kind of an also alternative, a lot of, there's this community with and I actually grew up with them all. I know them all, and none of them would really speak directly to me. And a few of them unfriended me on Facebook because I was following them. And because their post tells such a powerful story, I need to stop. But the whole point is this work, and my work as well, looks at the kind of the role of social power. And, you can't educate people into overcoming vaccine hesitancy or getting vaccinated, because the idea of vaccine hesitancy itself is a weapon of power. So using this knowledge to garner social status is a foundational and really difficult thing to overcome. So the complexity of vaccine hesitancy itself is much more deeper than just understanding the science, which we all know from living through this pandemic in America. But thank you for this time. There's so much more we could talk about, but I'll leave it there.
Thank you, Dr. Mendenhall. A very interesting presentation. Does anyone have a question out there? Perhaps you'd like to unmute or maybe put a question into the chat for Dr. Mendenhall. I see a hand up from Andrew Myers.
Yeah, hi. My name's Andrew. I work at the University of Montana. I've been working on COVID vaccinations for quite some time, specific to rural and disability. And I think that you hit the nail on the head when you said that you can't educate someone out of their position. So that said, what would you say is like the main 1, 2, or 3 takeaways from your stories?
For vaccine hesitancy?
Or just hesitancy around public health guidance in general?
That's a really good question. I would say, so what I argue in the Scientific American piece is that I think that we just need school mandates for children in elementary and high school, in public schools. I think that mandating for public schools is really, really important. We mandate a lot of different vaccines to enter school, and I think that COVID should be one, and I think it's important to do it now. Not everyone agrees, but I was actually talked to the global security folks at Hopkins, and actually a lot of people did agree with me. But there is the counter argument is that we need to do intense peer-on-peer movement. So have you read, I don't know if you guys followed this, but there was a daily message about this, episode about this, so maybe you followed it, but there's this woman, I think this is a good framework. There's this woman that led these red, wine and blue dialogues. And they were among moderate women, Democrats and Republicans, bringing them together to kind of talk about issues. There weren't people who were extreme on either side, but I think that that's really where some change in conversation can happen. And so if we were talking about peer-to-peer, I don't think it's only women, but I also think vaccine hesitancy among white men and white evangelical men is really different. It's more about this kind of ideas about dictation and it's definitely more political, but the social dynamics play out with women in really important ways. And I think that some of these culturally resistant communities, socially resistant communities, are really based on garnering social power. And we've seen this with chiropractors as well. In these communities, not all chiropractors, but the chiropractor kind of knowledge and kind of dynamics in small communities especially are very interesting and wrapped up in this. So focusing and targeting on transferring the conversation there really matters, but sort of mandates. One of the most important take homes is that local public authority and public health authority needs more power, and they have none. So that's really interesting, and something that people work at the city level, but not in rural areas. And I think that's a problem. Yeah. Oh, there's lots of questions here.
All right, thank you.
Another Okobojian.
Yeah, I was going to say in the chat, believe it or not, we have another Okobojian, Blake Lineweaver, who has a question about the research design. Could you describe a bit more in depth of how you framed your research design?
Yeah, of course. I'm an anthropologist, so I don't know how many anthropologists are here. But there is really different approaches to how people approach research. I didn't go in with a hypothesis. I went in just with questions. My question was like, I actually started with how can I help Zach figure out some intervention for the 4th of July? How can we get people to mask in restaurants? Because we were worried that a lot of transmission was happening in restaurants. And Blake, I don't know if you were there during that time, but I write actually about Maxwell's, which is a fancy upscale restaurant in town that closed down for 2 weeks and was publicly shamed on Facebook. And they had to write this whole statement in the local newspaper and apologize community, but say we're doing what we think is best for the community, and we hope you'll respect us and come back after 2 weeks. And so all of these local politics and ins and outs were there, but I just was asking for people's opinions and perspectives. And some people would talk for 2 hours, just tell me everything. And some people were really angry. Blake, you probably know the parks. People were really upset because the parks Marina is this big marina. They weren't really following guidelines. And a lot of people were reporting, and it came up in every single interview. And so people just had a lot to kind of share. And so I had a really open-ended questions. I had questions about what we should do, what we could do. How's your experience been? Can you walk me through the last several months? And those are the questions I asked. And I just got so much, people just wanted to talk. So that's kind of how I do research often. I have a small interview guide and let people talk and share. So should I go through the questions here, Gilbert?
Yeah. We have one about vaccine resistance from James Burkfield.
So if resistance is about power, how can power be redistributed so the desire for agency and respect won't be seen as an existential struggle? That's a really good question. I think, well, in the middle of a crisis, that's why I think mandates matter. But I mean, part of this is also modeling, and part of it, I mean, we can go back to Citizens United and also think about the complexity. I mean, it's a bigger, deeper question, right? It's power is excised through, the deregulation of capitalism, and like how we even think about how people feel secure in their lives. So the flexibility of the labor force and the decentering of families, and security, right, in everyday life also kind of upends and provides a space for grappling to power. So like how we even think about capitalism in our society is at play here. And this grapple for social power is gendered and classed and racialized in different ways. And vaccine hesitancy plays out really differently across racial, ethnic, and class lines and gendered lines. And this is really important to recognize, because vaccine hesitancy among people of color are very different, with in different, like among Black Americans, they're very different than Mexican Americans, for example. So where hesitancies come from and what they mean really differ, and that's important to say. But yeah, I think it's really complex. I don't think it's a quick fix. And I think that's part of all of my work. My outcome is always like, in my last book, Rethinking Diabetes, at the end, I give 25 ways to address diabetes. And everyone's like, well, what do you do? Like, I give you 25 things to do. It's not a quick fix. We can't just exercise our way out of this epidemic. It's the same thing, right? The answer is very complex and dynamic and structural and social and cultural. So Montana legislators, the authority of public health. Yeah, that's a good point, Andrew. Cultural scene with many parallels in Montana. Oh, interesting. Oh, did I change a vaccine hesitance mind? No, I have this wonderful whole chapter on vaccine hesitancy, which I think is so interesting. But when I did this like very long interview with this woman who I call Maureen, and it was so interesting because I think she we were talking and I sent her my consent form, and I talked to her. I was like, yeah, I'm just trying to learn more about how people are thinking about COVID in Okoboji, and what we could do to help public health. And she essentially tried to convince me to be vaccine hesitant. She spent about 60 minutes on it and then sent me all these texts for a while. It was very, very interesting. So she tried to change my mind, which was so wonderful as an ethnographer to get that perspective. But I wasn't able to change hers. But I don't think that's not the point of my research, but also not really possible, probably in this context. Did you explore how vaccine hesitancy during COVID? Yeah, actually, a vaccine hesitancy during the flu pandemic. Well, there wasn't a flu so quick, vaccine for the flu so quickly, but it was interesting because in Okoboji in Dickinson County, they actually the county supervisors closed down restaurants and businesses. They closed down businesses, so they closed down the town. And that's what's so interesting, because I did some archival research, and also like all my mom's friends were doing archival research about the flu. They were texting me. Oh my God, it was so funny. They were all sending me information and their perspective. I mean, I would get long letters from people I've known my whole life, just like their perspective, their takes. Everyone wanted to share with me. And from different perspectives too, which was really interesting. And then also people would call me. There was a physician in town who was basically telling everyone that COVID wasn't really a problem and not a risk. And a woman with a 83-year-old grandmother with diabetes and a kidney problem was told to just stop wearing masks and go on with her daily life because she wasn't at risk. And this was in September of 2020. So this woman was emailing me. She's like, can you get me in to see Zach? Because Zach was, had a lot of social capital because of all of his prevention work and communication work. And I was like, well, I can forward your message to him. I don't have that power, but so that was really interesting. A masking hesitancy. Yeah, I think there was masking hesitancy, but I don't have the ethnographic data really. But there were photos of people in mass in Okoboji from the pandemic. So that's such a good question. I wish I had more information on that. Mandates. I think, yeah, I think that they have to be federal mandates in schools, for example. I think those work, but I think it's really tricky. And I also think we're in, because we didn't start, I think a lot about, and I read a friend wrote from who I went to grad school with when I was studying public health. She worked at CDC, and then she was working in New Zealand, and she wrote about living in New Zealand during the pandemic. And this was June of 2020, right when I was doing all these interviews with people in Okoboji. And she was writing about compassionate leadership and how Ardern was leading in such an incredibly passionate, compassionate way with her language and her framing and her communication with the public and closing things down and responding to. I mean, we had a pandemic preparedness plan, a pandemic playbook written in 2018, or before that, 2015, and that was completely dismissed, especially when the Global Health Security Agenda Office was shut down by the Trump administration in 2018. So thinking about that, it was just really powerful to think about what compassionate leadership could do. There's been a lot of really great work written about in Rwanda. Wait, did someone say, oh, she works in Nepal and Uganda? So there's been a lot of really interesting things written about what compassionate leadership looks like and what it can be and what it can do. And I think if we had different leadership simply in communicating about masking from the beginning, I think all of you probably agree, we would be in a totally different conversation in situations. So I think that a big question is how will we as a nation respond to potential policymaking around future pandemics, because they will happen probably with more intensity as climate changes and the Arctic melts. And so there's a lot of really good questions here, and I'm sure we could talk for a really long time, but I want to respect all of you and thank you for coming and sharing this space with me.
Well, thank you, Dr. Mendenhall. That was a fascinating presentation, and I really appreciate you giving us some of your time and your expertise.
Yeah, it's such a privilege is mine. So thank you so much.
Thank you.
Thanks again.
Bye.